So what the learning objectives of today's presentations would be: what is addiction and behavioral issues with addiction? What are the basic terminologies that are used in when we talk about substance abuse and its dependence? What is the classification of different substances as per International Classification of Diseases? What are the physical, psychological, emotional, and social insults of substance use? And in the end, we'll talk a bit about delirium tremens. So, addiction. So, what is addiction? Uh, as per the National Institute of Drug Abuse, addiction is a medical disorder that affects the brain and changes behavior. So, a medical disorder that is affecting brain and resulting in changes in behavior. It is a chronic relapsing disorder characterized by compulsive drug seeking behavior and use despite adverse consequences. So, we can say that it's a medical disorder in which there is a compulsive behavior, compulsive drug seeking behavior despite consequences. So, there are certain things that come out from that definition, that that the drug addiction is uncontrollable. It is an uncontrollable and overwhelming need. There is an overwhelming need to use the drug. Uh, like you cannot control, like put yourself in such a situation that is way beyond your control, and still you are asked to control that thing. It becomes really difficult in that situation. Maybe you can control for a while, but not for long. So there's uncontrollable and overwhelming need to use that drug. There are long-lasting compulsions and return unexpectedly after a period of improvement. So if a person is in detox and he is clean now, then again there is unexpectedly return towards this addiction. So if a person is in addiction, that becomes really difficult to come out of that phase. So addiction is a complex thing, and it is, as we said, it's a medical disorder. So it involves reward pathways, it involves emotional centers, memory centers, perception, and judgment. So all these things are impaired. The reward pathways, emotional centers, memory, perception, judgment, those areas are disturbed. There are changes, and there are even changes are reported in the brain, that the brain structure, the prefrontal cortex and limbic system are disturbed. The brain pathways, the dopamine and serotonin pathways, there are some changes have been noted in the dopamine and serotonin pathways, and even the brain chemicals, the dopamine, serotonin, and endorphin, they do decline, their level declines. So the level changes with the substance use. So there are 4 C's that are quite common in addiction cycle, that there is craving. The brain is wired to crave rewards. Whenever you post something on Facebook and you'll just look around for those likes. With every like, there is a dopamine surge and you will feel happy. So that craving is there in addiction. Then comes the compulsions. As we talked in our previous slides, that there is disturbance in serotonin levels in the chemicals. So whenever there is low serotonin, the compulsions increases. The compulsions to take substance increases. Then comes the loss of control. As we said, there are damages to prefrontal cortex. So the person loses his control. And because of the disturbance in perception and in judgment, the person uses the substance even knowing what could be the consequences are. So if there are, if it is a medical disorder, If it's affecting that we just saw this brain centers, and even after that, what you call a substance use, what you call a person who uses the substance, you call him crazy. You call him that he has no willpower, he has no will to change himself. He is he is just useless, hopeless character that he would never change and he should be punished. At some point, people used to say that there is a punishment of from God that he is into the substance. So we label, and even we label that person with so many names in Urdu, powdery, charsi, jahaz, whatever you call. There are so many names. So I just wonder what is his fault if he lands in this addiction thing. So, coming towards the basic definitions that are usually used when we talk about addiction and substance use, the first one is drug use. Drug use is like drug taking behavior. Whatever the behavior of taking drug, be it a prescription drug or be it an illegal use, whatever it is. If a person is using a prescription drug or illegal use drug, we can say that there is drug use. Then comes drug misuse. Drug misuse, in this drug misuse, you need to just remember one word, that is inappropriate. If there is an inappropriate use of prescription drug or over-the-counter drug, if the doctor has prescribed you a cough syrup for the cough, and you are taking a bottle of cough syrup in one go, that is drug misuse. If the doctor has prescribed you anti-allergic medicine or a painkiller, and you are taking inappropriate and you're having inappropriate use of that painkiller, then that is drug misuse. Then comes the drug abuse or harmful use. Over here, then again there is one word, that is intentional misuse. Intentional. In the drug misuse, the word was inappropriate. In abuse or harmful use, the word is intentional. So if there is an intentional misuse or excessive use of a substance, that comes under the heading of drug abuse or harmful use. Harmful, we say that's because there is a pattern of psychoactive substance use that leads to problems, damage to health, that is loss of effectiveness in society, behavioral psychopathology, criminal acts, all these comes with the intentional misuse of that drug. Then comes the definition of drug dependence. Drug dependence is a maladaptive pattern of drug use leading to clinically significant impairment or distress associated with difficulty in controlling drug-taking behavior, withdrawal, and tolerance. The state of needing a drug to function within normal limits. That is the another definition, the state of needing of drug. I need a drug to function within normal limit. So I am dependent on that drug. The other definition, that's it's a maladaptive pattern of drug use. It's a maladaptive pattern that leads to clinically significant impairment or distress. So one thing is maladaptive pattern, the other thing is leading to clinically significant distress, and third thing is it is associated with difficulty in controlling the behavior, and comes the withdrawal or tolerance. So that is drug dependence. Then comes the drug withdrawal. What is drug withdrawal? These are the group of symptoms that occur upon discontinuation or decrease in the intake of substance. If somebody is taking certain drug and he has decreased the dose or he has discontinued the drug, then he or she will faces the withdrawal symptoms that varies as per the substance that person was using. So what is tolerance? Tolerance is a person's diminished response to a drug, and a higher dose is required to achieve the same effect. So for the tolerance, you can say that in order to achieve the same response, a higher dose is required for that drug. And for the intoxication, it is a reversible substance-specific syndrome due to recent ingestion or exposure to a substance of abuse. It varies, it again varies, the reactions or syndromes varies from one substance to another substance. What are the common behavioral issues that we see with addiction? Mood swings are quite common. Irritability or anger outburst. There is a need for privacy. A person wants to have a privacy. He usually avoid the people at home. He or she prefers to stay alone in his room so that he can have the substance. Then there is a risk-taking behavior. A person risk-taking, it could be while driving, risk-taking, it could be with stealing money from home or from anybody else. That is the risk-taking behavior. Then the other behavioral problem, there is lack of interest and judgment problems that are also noted with a person who is in the problem of addiction. Oh, this is not an organized slide. Okay, so this is the classification. International Classification of Diseases. As per the International Classification of Diseases, the different substances has been given different codes, and they have been classified accordingly. So the chapter is F for the psychiatric disorders, and the letter 1 denotes the area of substance use. So 10 is the alcohol. So all the problems related to alcohol, be it dependence, intoxication, withdrawal, all those comes under the heading of F10. Then comes the opioid, cannabinoids, sedatives and hypnotics, cocaine, stimulants, that is including caffeine, hallucinogens, tobacco, solvents, and F19 is multiple or other substances. So that's the this is the classification, and all these substances are classified accordingly under these headings. For the 4th year MBBS, what you need to know or what you need to understand is you should be knowing that there is a classification system, that is International Classification of Diseases, under which the different psychiatric disorders are classified with the letter F. And the substance use, as far as the substance use is concerned, the letter 1 is used from 10 to 19. 11, 12, 13, 14, 5, 6, 7, 8, 9. So what are the physical and psychological effects? These are the 3 main drugs, and the associated physical and psychological effects have been mentioned as accordingly. So for the alcohol, for the use of alcohol, whenever a person is using alcohol, they are found to have impaired judgment. The perception decreases, bad breath, hangover, that are quite common. And as far as the physical symptoms are concerned, there are skin problems, liver problems, sexual impotence, loss of appetite, and vitamins deficiencies that are mostly seen in the cases of alcohol. As far as the cannabis is concerned, most of the people feel sleepiness, some might not. There are bloodshot eyes become red when a person uses the substance or cannabis. Then there is decreased social inhibitions. He or she doesn't doesn't care what other people think. So there are certain social inhibitions, and he doesn't care about those inhibitions. The heart rate increases. What you need to keep in mind that the cannabis has psychological dependence. So whenever a person leaves or he is withdrawing from that cannabis and he's no longer wants to use this cannabis, so he'll experience psychological dependence. However, if you consider a substance like opioid, heroin, so if you consider a substance like opioid, whenever a person who wants to quit that opioid, he will face physical symptoms. Physical symptoms like diarrhea, vomiting. So he'll have those physical symptoms. However, physically there are no symptoms on withdrawal. There are with cannabis, there are only psychological dependence. So with the cocaine, there is an increased blood pressure, the heart rate increases, respiratory rate increases, temperature increases, and there are chances of MI and cerebrovascular accident. The behavior, as far as the behavior or psychological symptoms are concerned, there is anxiety, depression, a person becomes paranoid, and he might hallucinate in some cases. Then in the end, there are, I'm so sorry for this slide, the alignment of the slide. So this is the last slide, I believe. It is of delirium tremens. Delirium tremens is a very important state, and because it carries a mortality of 5 to 10%. So what is delirium tremens? Delirium tremens is an acute confusional state secondary to alcohol withdrawal. If somebody withdraws from alcohol, there are chances if he has been using that alcohol for quite long, there are chances that he might go through, or he might face this delirium tremens, which is quite common in first 48 hours when a person leaves this alcohol. However, it can happen. The onset can be from 1 to 7 days after the last drink. The risk the risk of delirium tremens increases if a person is severely dependent on this alcohol, if there are comorbid infections, and if there is a pre-existing liver damage. What happens in delirium tremens is the person faces clouding of consciousness, is disoriented, there is amnesia for recent events, and there is marked psychomotor agitation, visual, auditory, and tactile hallucinations. There is heavy sweating. A person might experience paranoid delusion, and there is raise in temperature. So, oh no, I believe there are a few more slides. So, what we should be doing? There are two strategies to address this menace of drug addiction. One is harm minimizing, and other one is drug eradication. Harm minimizing or harm reduction is mainly focused or mainly aimed at reducing the negative consequences associated with the drug use. So they said that you cannot control the supply. At least you should work to reduce the negative consequences of substance use. It is a non-judgmental, non-coercive provision of services and resources to people who use drugs, and the communities in which they live, in order to assist them in reducing attendant harm. So with this strategy of harm reduction, you go to those people who are using those substances. You go there, you educate them, and you should address them non-judgmentally. You don't have to force them, and provide those services so that the chances of harm can be minimized. Then there is another strategy, that is drug eradication. These strategies emphasize that the eradication of drug crops, so that reduction in supply so the reduction in supply will reduce consumption by increasing the street price. So if you are eradicating the whole drug crops, the street price of that substance will increase, and there will be like reduced consumption. Most of the people won't be able to purchase that drug. So that is drug eradication. These two strategies are used to reduce this menace. So what are the risk factors, and what are the protective factors towards this drug addiction? The risk factors are aggressive behavior in childhood, poor social skills, availability of drugs at school, and lack of parental supervision, drug experimentation, and community poverty. If whenever you take the history, you'll be focusing on these points, which are the risk factors in the case of that particular case, so that that can be addressed. And there are protective factors as well. If there is a self-control, the relationship, there are like healthy relationships. School has the anti-drug policies. There is parental monitoring and support, and academic competence and neighborhood pride. So all these factors are protective factors that are, and these are the efforts aims at the children and adolescents to keep them away from the substance. So what should be the treatment in the cases of substance use? As we said, that it's a medical disorder. So the treatment is multidisciplinary. Medication are there, use of medication is there, but that is way below. First of all, there is a cognitive behavioral therapy. You need to enroll them in cognitive behavioral therapy. Although the detoxification, it all you have to start this cognitive behavioral therapy after the detoxification phase, and there is one-on-one or couple counseling. There are group therapy, like the group of Alcohol Anonymous and others, and there are certain groups for opioid and cocaine also. So all these, in all those groups, the people who were using that particular substance, they talk about that substance and their journey, how they fought and they come out of it. So that really helps the other newcomers of that group. Then there are medications. There are certain medications that can be used and certain methods. However, over here, we use symptomatic treatment because the replacement drugs are not available here in Pakistan. So we usually treat either as cold turkey or with the symptomatic treatment. And then comes the self-help groups. Thank you so much for your attention. And beside all these treatment options and all that, the first step would be to recognize that problem. When we are going to recognize that problem, that yes, substance use is in itself